Broken heart syndrome is a real thing. It's often a short-term heart condition caused by stress. Here today to talk more about this condition and sponsoring our segment from Carle Health is Dr. Ken Bodine. Thank you so much for being here.
Thank you. It's a pleasure.
So what is broken heart syndrome exactly?
Yeah, well, it's a very interesting condition that we see, and it was initially described in the early 1990s in Japan. They reported a series of cases where patients had been exposed to extreme emotional or physical stress and developed a stunning of their heart. And what happens is the heart actually balloons out and becomes very weak and doesn't pump very well.
Oh, wow. And what are some of the symptoms that people should look out for?
Yeah, the symptoms actually are very similar to a heart attack. Most common symptom is going to be chest pain. Also can get shortness of breath. You might feel nauseated, sweaty. So if you have those sort of symptoms, we certainly recommend that these patients get into an emergency room and be evaluated quickly. About 5% of the time, patients that we think are having a heart attack actually are having this broken heart syndrome. And it is very important for us to distinguish the two, because patients that are having a true heart attack usually have some sort of blockages in their coronary arteries, whereas people with broken heart syndrome, the arteries are usually really pretty good and they don't have blockages. So we're going to treat them differently.
And so how are you able to make that determination? If somebody does come to the emergency room, what kind of tests would be run?
Yeah, the first test that we usually do is going to be like an EKG and some blood work, which will look at enzymes that come from the heart. They're going to usually be about the same, whether you're having a heart attack or broken heart. But when we do other tests, like what we call an echocardiogram, an ultrasound on the heart, or a heart catheterization, where we actually can look at the arteries around the heart, we find out that they actually have this typical picture of this ballooned out heart and relatively normal coronary arteries.
Oh, wow. And so who is most at risk for broken heart syndrome?
It's very interesting. It's much more common in women. Probably 80 to 90% of the cases that we see are women. Generally, they're over 60, but we do see it in men and younger individuals, so we have to be very vigilant when we're evaluating patients with chest pain. And there does seem to be some association with certain psychiatric and neurologic conditions. People that have anxiety disorders, depression, seizure disorders, they do seem to be at a little higher risk than the average person.
And then what is the treatment for broken heart syndrome?
Well, the good news is that 90% of these people recover fairly quickly. Usually within 1 to 4 weeks, the heart function goes back to normal.
Oh, wow.
But about 10% can have serious complications. These could be things like heart failure, blood clots, rhythm problems. They can even die. So we always hospitalize these patients and usually monitor them for about 2 or 3 days before we feel it's safe that they could potentially leave. And a lot of times we'll put them on some medications that helps the heart muscle to relax while it's recovering.
Okay.
And sometimes these will be long-term medications. Each case is going to be a little bit different.
That was going to be my next question. Is it a medication thing? Is it just once the stress is kind of out of the way that things kind of go back to normal? Is there anything that people can eat or do to potentially prevent getting broken heart syndrome?
Well, there's probably two main things. It's really hard to identify who could potentially get this because it is a relatively uncommon condition. But people that have some of those psychiatric or neurologic conditions that I mentioned, if they can get those addressed to help lower down your stress level or how you tolerate stress, then also people that have some of the standard risk factors for heart disease also seem to be at increased risk. So following a heart-healthy lifestyle, which would be diet, exercise, maintaining a proper weight, and not smoking are all going to be helpful.
Well, thank you for all this information and for being here today and sponsoring our segment.
All right, thank you. I appreciate it.
If you want more information about Carle Health, you can visit us on the web at ciLiving.tv after the show.